Good afternoon. My name is Daniel Moore. I'm a nurse practitioner student at Alcorn State University. Today we're going to be conducting a focus assessment. Ma'am, could you state your name and your age for me?
Candace Moore, and I'm 25.
Okay, and what brings you here today?
I've been feeling dizzy lately.
Okay. It's very important when you're investigating a common complaint of dizziness that you ask a focus history to kind of discern. The history is very important in discerning the cause of dizziness. Also, it's important to do a thorough head and neck examination. When the patient walked in, we observed her gait. It was very important to observe gait. You're looking for any kind of shuffling gait or any deviations to the left or the right. The patient had a normal gait. Also, when interviewing the patient, it's important to pay attention to their voice, their speech. Notice any slurring or any nasal or hoarse sounds. So we're going to start with our focus history now. Okay, ma'am, when did the dizziness start?
About 3 weeks ago.
About 3 weeks ago. Okay. How long does it last?
About 15 minutes.
Okay. Is it really severe dizziness? What does it feel like?
I just feel kind of lightheaded when I get out of bed in the morning or if I stand up.
Okay. How long does it last?
About 15 minutes.
About 15 minutes. Okay. Have you ever experienced anything like this before in your life recently? Okay. All right. Have you started on any new medications in the last 2 or 3 weeks or beyond that?
No.
All right. Any over-the-counter remedies?
No.
Okay. How about tobacco? Use any tobacco products or smoke cigarettes?
No.
Okay. What about alcohol?
No.
Street drugs, marijuana?
No.
Okay. Are you allergic to anything?
No.
Okay, no medicines, environmental allergens, or food allergies? Okay. Have you ever had a seizure before?
No.
All right. When this dizziness happens, do you lose consciousness? Do you black out?
No.
Okay. Do you have any other associated symptoms that go along with it, like a ringing of the ears or nausea?
No.
Okay. Okay, no cold feelings or anything like that? Do you get short of breath?
No.
Have you gotten short of breath recently, beyond exercise? Do you get much exercise?
Yeah, I exercise about 3 times a week.
Okay. Do you get short of breath any more than usual?
No.
Okay. All right. So you said nobody in your family has any kind of history of epilepsy or having seizures? Okay. What about any recent trauma? Have you been in any vehicle accidents or sustained any blows to the head? Have you had a fall?
No.
Okay. All right. So now that we've kind of conducted our history, we got a set of vital signs when she came in. Blood pressure was 118/62, heart rate was 62, temperature was 98.1, and O2 sat was 99. Are you hurting anywhere today?
No.
It's important to ask the patient about their overall comfort level. Have you been experiencing any pain recently in the last week? Okay. The patient appears to be in good hygiene. No foul odors noted. I'm looking for obvious signs of trauma or neglect, abuse. I'm going to start with examining the patient's head, and what I'm looking for is signs of trauma or deformities. I'm just going to have a look and feel. I want you to tell me if any of this hurts. All right. Any pain there?
No.
All right. I'm examining the head for lesions or nevi, parasites. The hair is evenly distributed. It's dark brown. It's fine. No breakage. All right. Could you look up for me? Okay. All right. Now I'm going to examine the sclera and the conjunctiva. All right. They're pink and moist. There's no yellowing noted or any discharge. Okay. I also want to palpate the sinuses. Have you been sick recently? You had a cold, congestion, or anything like that?
No.
Okay. All right. Does this hurt at all?
No.
All right. Good. Okay. Sometimes sinus tenderness and sinus infections can cause dizziness. All right. So we're going to start with our neuro assessment. We're going to start with cranial nerve 2. It controls vision. What I want you to do for me first is I want you to look at this chart over here, all right, and I want you to cover your right eye, all right. I want you to read the smallest line that you can.
DEFPOTEC.
Okay. And the left eye?
DEFPOTEC.
All right. It's important when conducting this assessment that if the patient wears any glasses or contact lenses, that they have them in. Ma'am, do you wear glasses or corrective lenses?
Yes, I have my contacts in.
Okay, good. All right. Now we're gonna continue to check vision. We're gonna check cranial nerves 3, 4, and 6. All right. What I want you to do is I want you to follow my finger. Okay. And I'm gonna move my finger in the shape of an H, and I want her to track extraocular movements. All right. That's cranial nerve 4, 3, up, 3, okay, all right, and that's 6, lateral rectus. I want you to follow my finger. All right, good. Testing confrontation there. I also want you to pick a spot on the wall over here to look at. Okay, all right, now I want you to look at that spot, focus on it. All right, now I want you to look at my finger. Okay, I'm testing accommodation. All right, and again at the wall. All right, and again at my finger. All right, try to do it one time with your head still, please. All right, can you look at the wall? All right, now look at my finger. Good, okay. All right, now we're going to go ahead and examine the eye. Following the red reflex in, looking at the optic disc, looking for any kind of cupping. Same thing. All right. No abnormalities there. Okay. Also, it's important, I just wanted to verbalize this, when looking at the extraocular movements that we track for nystagmus, that can be indicative of vertigo, and that would be while one eye follows the finger, the other lags or tries to look the other way, and none of that was noted. All right. Okay, so now that we've done 3, 4, and 6, we're going to move on to 5, the trigeminal. All right. What I want you to do is I want you to clench your teeth for me. Good. Okay. All right. Now I'm going to touch something up against your cheek and your forehead, and I want you to tell me if it's soft or sharp. Okay. All right.
Soft. Sharp.
Okay.
Soft. Sharp.
Okay. Very good. All right. Now I want to move on to the cranial nerve 7. It innervates the face. I'm looking for any signs of asymmetry. I want to ask the patient to puff up their cheeks for me. Okay, both cheeks puff up symmetrically and equally. Okay, I want you to raise your eyebrows for me. Okay, good. Now can you do one side at a time? And back and forth? Okay. All right, thank you very much. Okay, so far all the cranial nerves seem to be intact. We're going to move on now. We're going to go to 8, and 8 is hearing. We're going to start with the whisper test. I'm going to whisper a 2-syllable word in her ear and cover the other one and have her tell me what it is. Okay?
Apple. Bottle.
All right. Next, I'm going to conduct the Rena and Weber test. First, the Rena. I'm going to hold this tuning fork. Ma'am, it's going to play a sound, and I'm going to hold it in front of your ear. I want you to tell me where you hear it the loudest, in position A or position B, okay? All right.
A.
All right, good. very good. Okay. Now, we're going to do this again. I'm going to place a tuning fork at the top of your head. I want you to tell me if you hear it louder in the left ear, the right ear, or if it's equal in the middle, okay? All right.
It's equal.
Okay, good. All right. All right. Now that we've assessed cranial nerve 8, I'm going to have a look inside the ear for any abnormalities. I'm looking for erythema, perforation of the tympanic membrane, something that would give me a cause of the dizziness, the right side, or I want to rule out vertigo. Visualize inside the ear, looking at the ear canal, no erythema, no impacted ceramun, no perforation of the eardrum tympanic membrane. I'm gonna have a look on this side. Alright, same thing on this side. No erythema noted, no ceramun impactions, no perforations. You kind of see the malleus there. So no abnormalities noted structurally within the ear. Your ears haven't been hurting you or ringing or okay, no kinds of earache or anything like that?
No, my ears have been fine.
Okay, good. All right. Next, we're going to move on to cranial nerve 9, hypoglossal. All right. What I want you to do is I want you to stick out your tongue for me, like that. Okay. Can you stick out and leave it out, please? Thank you. Okay. And what I'm looking for at this point is any kind of deviation to the left or the right. All right. I'm also observing the tongue. It looks a little dry. Okay, very good. All right. Now, what I want you to do is I want you to say "ah" for me. All right. I'm assessing cranial nerve 10. I'm looking at the rise and fall of the uvula and the soft palate and the hard palate, making sure everything's symmetrical. There's no deviation. Okay, ma'am. This may be just a little uncomfortable. Okay. Okay. Gag reflex is intact. All right. Now I'm going to look at the nose. All right. I'm looking for any drainage. Have you had any kind of nasal congestion or runny nose or anything lately? Okay, good. All right. All right. I'm looking at the septum. It's midline. All right. No drainage noted. Everything looks symmetrical and pink and as it should. Okay. All right. I just want to take one last look at the mucous membranes. I'm assessing for dehydration. If you could, say out for me. All right, I'm looking at dentition. All right. Inside the gums. All right. Pink and moist. Dentition seems to be fine, not missing any teeth. Tongue looks a little dry. Maybe a little slight signs of dehydration. So we've assessed cranial nerves 9 and 10. All right. Now we're going to assess cranial nerve 11, which is the spinal accessory nerve. What I'm going to do is what I want you to do, ma'am, is I want you to push up on my shoulders. Okay. All right. Good. Okay. What I'm looking for is I'm looking at symmetry. I'm also looking at the trapezius muscles, making sure that there's no deviations there or anything abnormal. All right. One more time. Can you push up for me? Okay. Good. All right. Next, we're going to move on, and we're going to I just want to rule out any kind of cardiac causes of dizziness. I'm going to ask you to go ahead and lay back on the bed for me. All right. And I'm just going to listen to heart sounds and lung sounds. Like I said, you haven't had a call for any kind of congestion, felt short of breath, things? Okay. No. All right. I'm going to listen to my heart sounds. Listen to the S1 and S2. Yeah.
down the left sternal border, pulmonic, tricuspid, and then mitral.
Get under there.
Appears to be regular rate and rhythm. Alright. I want you to, can you lift your gown back up for me, ma'am? I just want to note the rise and fall of your chest, okay? Alright. Can you take a deep breath for me? Alright. Lung sounds are clear. I didn't hear any kind of abnormal clicks, gallops. I want to just observe the chest for a minute. I'm looking for heaves and thrills. Anything that might explain a cardiovascular cause of this dizziness. Okay. Getting down eye level. Noticing symmetric rise and fall of the chest. Alright, I want to try one last thing, ma'am. If you could, we got your blood pressure earlier when you were lying down. I want to check your blood pressure again and your heart rate and see if we can kind of recreate this dizziness that you've been having. So if you could you sit up on the side of the bed for me? Alright, and while I have the patient sitting up, I'm going to just listen to her heart sounds one more time while I'm waiting the requisite 2 minutes and see if I can hear anything that I missed before. Okay. All right. I'm going to check your blood pressure one more time. Did you feel any dizziness when we moved you from the lying to the sitting position?
Yeah, a little bit.
A little bit? Okay. Alright. So from a sitting position, we have 102/60, and I'm wondering if this isn't a postural orthostatic dizziness. Heart rate seems to have gone up a little bit. 78. Alright. One last thing, ma'am. I want you to stand up on the side of the bed. If you could. Are you okay?
Yeah, just
A little dizzy? Do you feel like you're going to fall?
I'm okay.
You're okay?
Yeah.
Alright, okay. Alright, I want you to hold on to the side of this table, okay? There you go. Alright, if you feel like you're going to fall, just sit backwards, okay? Or you can lean on me, alright? You're going to wait just a few minutes and then we're going to check your blood pressure again, okay? She already kind of started to tilt when we sat her up. Blood pressure went from 118 laying earlier over 60 to 102 over 56, and your heart rate's up to 78. So normally a rise of 20 beats per minute or more and over a 10 to 20 point drop in systolic blood pressure is indicative of postural hypertension. Patient states she's been on a diet recently. I'm worried about her sodium levels and her fluid intake. I would get some labs to check that, CMP and a CBC. And also a urinalysis for specific gravity. Right. And you haven't noticed any burning or anything when you're urinating, huh?
No.
Okay. Good deal. 96/54. Grayson. All right. It's approximately 96, 98 beats per minute now. You can sit down, man. So we have a near 20-point drop in systolic and a 30-point rise in heart rate. So I guess we can diagnose the patient with orthostatic postural hypertension, probably secondary to just the caffeine, not drinking enough water, and the dietary changes are recent. So what I'd like for you to do is increase your water. Yeah, 4 to 6 bottles of water a day, okay? Cut back on the caffeine, and, just try a regular diet. And I want you to call me and let me know in the next few days if the symptoms persist. All right, we'd like to thank you for taking part in our assessment today.